Friends, I'll just share with you this one image. This one image depicts beautifully the entire syphilitic miasm. It shows you stars, which says aggravation at night. Look at the expression, the gloominess, the sadness. So aggravation of night is depicted, and see the lettering which has been used. It is irregular, not representing the correct picture. And that is what syphilis is. Hatred, hatred towards self, hatred towards others. And just one slide, we can learn so many things. Now you may have, a child may reach into a syphilitic phase through one of the following ways. What are these different ways? It may acquire syphilitic traits right from birth, where there is a parental inheritance. If there is a strong parental inheritance, it can give rise to this kind of trait. Or there is a history of syphilis in the family. There is a strong history of syphilis or syphilitic miasm in the family. If you have children with mental retardation, they are already in the syphilitic phase. Or the parents have sexually transmitted diseases, then it is in the syphilitic phase. Or when the child is born to the parents after a very long time of marriage. Suppose the parents have been married for many, many years. Till very late, they don't have any children. And when the delivery happens after 38, 39, 40, quite a few children go into a syphilitic phase right from the beginning. Or child may go slowly from soric to syphilitic phase depending upon the external influences. Child may slide into soric to syphilitic phase. Or gradually go from soric to psychotic to tubercular and then finally into syphilitic phase. So there are a number of ways a patient can travel from soric to syphilitic phase. Or it can happen when you give some inappropriate treatment, or very strong suppressive line of treatment is given. Then the patient transfers from sora and it can jump directly into syphilitic phase. We have seen some cases. The patient was completely all right, and then suddenly one fine day you find the patient suffering from malignancy. See, every picture has been taken very carefully. If you see this, one wheel, it is crooked, the other wheel is in other direction. Okay? So every picture has been thought and put. So if you give your 100% to it, you'll be able to understand a lot of points. Now what happens? Now we go to the childhood. The formative years of the syphilitic children are unorganized. They are not very organized. Like in healthy stage or a soric stage, everything is organized. But here you will see a lot of unorganized behavior, response, development, and they are in a big mess. They are in the big mess right from young days. These children have moderate to severe delayed development of milestone. Moderate to severe developmental milestones. They will not be able to hold their head at the right age, or teething is delayed, walking is delayed, talking is delayed. And this is very, very characteristic. All forms of mental retardation falls into this miasm. So what we go for, physical defect, the genetic defect, all these defects go into this miasm in a big way. Like for example, cleft palate, syphilitic expression, congenital heart disease, syphilitic expression, anything, vision deformity at birth, hearing deafness at birth, these are all syphilitic expressions. All mental retardation go into the syphilitic phase. You know, some of you had asked the question, can right from birth, can the child have syphilitic phase? Yes. And here is the answer. Here is the answer where the child is already in the syphilitic phase. Resistance of these children is very poor. Okay? So when they come to you, any stage of this patients is very, very poor. When they come to you, they come already in an advanced stage of disease. So you cannot promise them that you will cure them, you will relieve them. Your only thing you have to say is you will be able to relieve them. Okay? So resistance to these children, to the disease, to the external infection is so poor that by the time they report to you, they are into already advanced pathology. And that is why it is very, very difficult to manage. So don't commit to them anything. Don't promise them anything. Don't promise them moon that you will be able to relieve them very easily. This miasm is full of destruction. And friend, that is the reason I am wearing this color. If you remember the first session where we had shared very clearly what is the color of preference of syphilitic miasm. The red, the black, and the blood. If you see that all miasmatic expressions are related with destruction, and destruction in human being means blood. So some of you wonder why I'm wearing this kind of color. It has a definite meaning. It has to connection with the miasm. So destructions, what level? It will have tremendous violence. If you see this patient, they get angry very fast. They hit people, they fight people. They are very quarrelsome. They will not resolve the issues with verbal arguments. They will straightway get physical. And the reason they get physical is because they are insecure from within. They feel that they are threatened. And when you are threatened with something, there are only two reactions. One is flight, other one is fight. They always choose the method of fight, the violence. They have lot of negativism. They will be always pessimistic in their life. Psoric is optimistic all the time. Psychotic is always sitting on the fence. Tubercular oscillates between optimism and pessimism, optimism and pessimism. while syphilitic is always, most of the time, 99.99% in a pessimistic stage, unless it is early transition from tubercular to the syphilitic phase. Otherwise, it is most of the time negative. There is always degeneration, premature senility. You'll have young children with gray hair. That is degeneration. You will have children with necrosis, degeneration. Young man with cancer, it is syphilitic. Degeneration, destruction, degeneration of self, degeneration of others is the root of syphilitic miasm. Every input in this phase is handled in a different way. We had shown you the structure, how the human body reacts to different inputs. In all the three previous miasm, we had shared with it. Sensitivity of these children is very low. Susceptibility is also very low. Okay? So that is why we require low potency in these people. So it is very difficult to cure syphilitic patients unless they have good vitality. Homeopathic medicines can help these children to recover completely if they come early. It's very important. Okay. Otherwise, we can help them with palliation. Palliation is also what we can offer them with. With appropriate homeopathic treatment, they can be offered with longevity, with better health, better quality of life. With appropriate treatment,